Wilson disease, hepatolenticular degeneration, inherited copper transport defect, and excess copper accumulation and cytotoxic damage in the target organ like liver and your brain, your and other organs also. So here it is autosomal recessive disorder where the your Wilson disease gene is defective, coded by the chromosome 13 for ATP7B needed for copper excretion. If gene is defective, this copper excretion will not be good. They will be accumulating in the body, in the liver. You have the hepatic Wilson, in the brain. You have neurological Wilson. So, and what is the role of copper in the body? It is a cofactor for many enzymes, including cytochrome and ceruloplasmin, and other enzymes also are being affected when copper is excess. And then, so copper also damages these said organs like your lenticulus nucleus, brain stem cells, thalamus and cerebellum, and cerebral cortex at the end. Eye involvement is also possible. Cave ring, Kaiser Fleischer ring is in the decimal membrane of the cornea, and you have renal tubular deposition of copper gives rise to your Fanconi syndrome in the proximal tubulopathy. The disease starts in the first decade of life, and up to fourth and fifth decade, it is possible to have its face. There can be vague symptoms. There can be features of the acute liver involvement, and there can be features of chronic liver disease (CLD) with portal hypertension and so forth. And there can be gallstones. Neuropsychiatric features is quite common in neurological Wilson, and there can be osteomuscular involvement and features on those sides. There can be renal features like tubulopathy, proximal tubular disease, and then polydipsia and others. So the investigation of these child basically is reduce your ceruloplasmin. More than 20 milligram per DL is said to be diagnostic. Normally it is more than 20. So, and then when it is less, you have ceruloplasmin, Wilson. And urinary 24 hours your copper estimation is gold standard. 1600 microgram per day is the cutoff value. When someone does have this more than 1600, you have excess copper in the urine. And then hepatic copper estimation by the hepatic biopsy, more than 20 microgram per gram is of dry weight of liver is said to be diagnostic of your Wilson. And then free serum copper estimation is obviously it will be high, and your neuroimaging to see the extent of damage by the Wilson. And finally, genetic study, family screening, and there is a modified Lipschitz criteria and scoring to categorize, to diagnose Wilson. These diseases are to be treated. With your penicillamine, zinc, and triamterone, and dimercaprol, or the British antilucide in oil, and the lifelong treatment is So it takes usually 3 to 6 months to have symptom regression and biochemical improvement, the hypercoppeремia, and increased urinary copper and decreased ceruloplasmin. So treatment is lifelong. Good amount of time. You do have your higher renal hepatic progression. You have liver failure, and transplant of those cases are useful.